بسم الله الرحمن الرحيم. ان شاء الله النهارده هنتكلم على multidisciplinary management in schizophrenia. So today we are going to discuss multidisciplinary management in schizophrenia. My name is Dr. Muhammad Al-Wasifi, Assistant Professor of Psychiatry. So today we are going to have some MCQ questions regarding different aspects of the treatment, and we'll give an overview on the treatment and management of schizophrenia. Let's go over the MCQ questions rapidly. Which of the following clinical features would be helpful in identifying comorbid depression in patient who has a prominent negative symptoms? If you look for this question, you will finding that the golden one is guilty thoughts. This is specific for assessment or diagnosing of depression. So the next question: which of the following non-genetic factors contribute most to the risk of developing cannabis? They found this in the chronic psychostimulant used like cocaine, amphetamine is like the most one. So we can find a lot of items is can be right, but we asking about the most. So which of the following has been found in your imaging study of the patient? You will find that the one's right is decreased volume of hippocampus. So which of the following pharmacological strategy increase the likelihood of sustained recovery? The most one is to give the antipsychotics close to the onset of psychosis as early as possible. So the early intervention is the gold stone. Antipsychotic medication is most likely to improve which of the following schizophrenic symptoms is most likely. So the most likely is the disorganization. Which of the following psychosocial intervention has been shown to reduce relapse rate? Is the family psychoeducation is a golden standard in psychosocial intervention. Schizophrenia management for which patient will get benefit from the outpatient CBT is a long-standing psychotic illness. Which of the following drugs is most likely to produce less prolongation is the aripiprazole. So the schizophrenia, it might be difficult to tell what caused the first episode of psychosis. There are many possible causes. So doctors and other healthcare professionals are not trying to hide anything. They want to be sure the cause before making the diagnosis. So schizophrenia affects 1 in every 100 people. Is an extremely complex mental illness. It's difficult to distinguish from other mental health problems and make a diagnosis. Can cause a number of different changes in the person's thinking, feeling, behaviors. It is believed to be caused by an imbalance of the brain natural chemicals. Is treatable with psychotherapy and medication. So schizophrenia over time, each person's journey is unique. Some only experience one episode in their life. Some experience long periods of wellness between the psychotic episodes, while others may experience psychotic episodes that last a long time. Some people experience a psychotic episode without warning, while others experience many early warning signs. So what we want to say that it is variable. Some may have one episode, some may have a lot of episodes, some may have a sustained remission in between these episodes. Some may have a warning sign, some not. So the feature of schizophrenia can be with positive symptoms, negative symptoms, cognitive domains. It can be the loss of insight. It is one of the domains of this. There can be some mood symptoms. There is also can be associated with comorbid substance abuse. There is all of these associated with social and occupational dysfunction. So localization of the symptoms, we have a positive symptoms from the mesolimbic, we have the negative symptoms from the mesocortical, we have the cognitive symptoms from the dorsolateral prefrontal cortex, we have the aggressive symptoms from amygdala and the orbitofrontal cortex, and we have the affective symptoms from the ventromedial prefrontal cortex. So the natural history of schizophrenia, we have a pre-morbid, then the prodroma, then the onset, then we have 3 phases of the illness: acute phase, continuation phase, and maintenance phase. So, and treating schizophrenia, improving the hope of recovery. So, recovery is possible. The right treatment strategy can help people with schizophrenia get their lives back and live their lives to the fullest. So, what are the key goals? Achieve, maintain remission, achieve functional recovery, improve quality of life, prevent relapse, prevent the progression of the disease. Where are people with schizophrenia usually treated? Treating setting vary from person to person and at different stages of the disease. So it may be for example, the first episode, they can need hospital for the stabilization phase. They can have hospital admission, outpatient treatment, primary care. For the relapse, we can have a hospital admission, outpatient. So let's see, what is the multidisciplinary management of schizophrenia? It is a joint effort between the primary practice and secondary care. The combination is essential. So it takes a team effort. So possible members of for the treatment plan, it can be, as we see, it can be the psychiatrist, it can be the counselor, it can be the social worker, it can be the pharmacist, it can be the family, it can be the friends, it can be supportive group, it can be from the medical doctor or primary health care doctor, nurse practitioner, family doctor. So the importance of early treatment for schizophrenia, the sooner the psychotic episodes appropriately treated, the better the potentially outcome. And we have a MSQ question about this. So non-proper medical care, the disease worsens. Proper medical care, recovery is possible. Importance of avoiding relapses. The emergence of symptoms are associated with a chance of future relapses, more hospitalization, worsening of functioning, damage to the brain, reduce the ability to maintain a job, less chance that the medication will work properly, and the chance of stopping medication. What's the psychosocial treatment for schizophrenia? As we have the multidisciplinary, we have the cognitive behavioral therapy, helping people to develop the skills and strategies for becoming and staying healthful. Cognitive remediation, using training and practice to improve memory and attention. Psychoeducation, and this is a gold stone. You have to educate the patient and their family about the nature of the disease, about the course, about how long they will be treated, about how can they help their patients. The social skills, and this is targeting the communication skills. Family support and education and the family counseling. This is very essential, that helping family members develop effective way for coping, helping to understand recovery, improve communication skill, providing relapse preventing strategies, providing stress management training, such ways for supporting each other in time of crisis. So this is like we are going to explain what we say. We say that schizophrenia treatment requires integration between medical, psychological, psychosocial. This is the team that needed for the treatment. We said this before. So we have also one of the modalities for the treatment is the ECT. We can use for if the patient have acute symptoms, suicide, homicide, having catatonic features. It is not as you think that when we give this patient ECT we are going to make him having pain. This is false beliefs. It can be used unilateral or bilateral. So the exact mechanism is unknown, but it produces changes in the neurotransmitters, even in the second messenger of the protein. It changes the chemistry of the brain. So let's go over the psychosocial intervention. As we mentioned before, they have a role in avoiding hospitalization, decreasing the relapse, to increase the compliance with medication, to improve the function. So we mentioned this before. We having the family intervention, including psychoeducation, communication skills, helping family to deal with the stress, early warning signs for recognition, crisis management. So social skills training are mainly having that involving assessment of individual social skills, followed by individual or group interventions. Using positive reinforcement, we try to encourage them to do the good behavior, goal setting, modeling, and shaping. So we have also cognitive remediation, and this is based on the general that we increasing helping the patient to improving their memory, their attention, their ability to thinking, teaching new information processing strategy, individualizing treatment, helping to transfer the improvement of cognitive function in real life. So we have the CBT, as we mentioned. This is how we integrate the relation between the thinking, the behavior, and the emotion. and helping the patient to correct the misperception or the misbeliefs or the negative thoughts, and having alternative ways for coping. So the supportive psychotherapy aiming to personal discussion, I mean changing or influencing ideas or emotions, and exploiting of mental conflict, establishing of emotional relationship with the patient, minimize and preventing deterioration and relapse, helping the patient coping with their can be individualized psychotherapy or group psychotherapy, can be supportive. So we come to the conclusion: the importance of healthy living for people with schizophrenia, that making one feel more energetic and more relaxed, improving mood, reducing stress. So so this is very important to having a healthy living. So as regarding the medication, you know that the form of medication, the main form of medication that we used for the treatment is antipsychotic drugs. We have other drugs can be used like benzodiazepine, mood stabilizer. We can use antidepressant. Sometimes if we're having depressive symptoms, so we have a lot of medications. As you know, the antipsychotic is like we having the first generation, we have the second generation. So the second generation is more associated with more metabolic symptoms. The first generation is more associated with extrapyramidal symptoms. So how they work, they actually that the antipsychotic working by helping to rebalance in the communication system. They each medication has different effect on various neurotransmitters. They mainly acting on the excessive dopamine by blocking the dopamine, the new class or the second generation working on serotonin and dopamine. So antipsychotic can be available as a tablet or can available as injection. So we have to choose a suitable method for each patient. And for general, the long-acting injection can helping in improving compliance and give the clinician much time to discuss other aspect of the disorder with the patient. So we have to address the varieties of the treatment, and we have to consider the long-acting antipsychotic, especially with patients who are not compliant with medication. So we can having varieties of the antipsychotic, like, and we can choose which one we have to give for the patient. So let's see about the expectation for the treatment with antipsychotic. Out of every 10 people with schizophrenia treated with antipsychotic medication, 6 or 7 will experience substantial improvement. The 3 or 4 will not, but they may respond to a different antipsychotic treatment. Of those who experience substantial improvement, about half will experience a full remission for positive symptom. The other half may have some positive symptoms despite taking the medication. So we have to teach the patient about side effect. As I mentioned, the main big two categories is like the extrapyramidal side effect, and we have like the metabolic side effect and anticholinergic side effect. We have to give the patient a rough idea about this, so in order to know what he expects and how can he tolerate the side effect. So we have alternative therapies for schizophrenia, like vitamin supplementation, herbal, but still they don't have evidence-based practice for this, but there is some point about this. So usually you have to give hope for your patient. Schizophrenia symptoms can be management. So antipsychotic medication is a critical component. Early treatment is associated with best outcome. To find the best option, trial and error is sometimes necessary. In planning ongoing treatment and support for someone with schizophrenia, it's essential to have a strategy that integrates both pharmacological and psychosocial. So, and above all, never ever give hope. Thank you for your kind attention. If you have any questions, please contact me and we will